Hi, I'm Audra Burns from Dartmouth-Hitchcock, and welcome to the fifth in our series, Heads Up through Coping Through COVID-19. Today, we'll be focusing on the challenges that adults may be experiencing as we navigate this pandemic, including stress, anxiety, depression, and other mental health concerns. I want to remind viewers that questions for our experts can be submitted to social@hitchcock.org or comment in the thread below. If we don't get to your questions in time for this webinar, they will be posted in the comments below, as well as an FAQ page on our website. Today, I'm joined by Dr. Robert Brady, Director of Anxiety Disorder Service at Dartmouth-Hitchcock and Assistant Professor at Geisel School of Medicine, Dr. William Torrey, Professor and Vice Chair for Clinical Services for the Department of Psychiatry at Dartmouth-Hitchcock and Geisel School of Medicine, and Ken Norton, Executive Director of NAMI New Hampshire, the National Alliance on Mental Illness in New Hampshire. Thank you, all of you, for joining me today.
Thanks for having us.
Great to be here.
So, Dr. Torrey, how is this pandemic affecting people who live with mental illness or unhealthy substance use, and what resources are available to help?
Thanks, Audra. First of all, it's a great honor to be here with Ken and Robert, who I've known for many years and have great respect for both of them. The COVID-19 pandemic has really shaken a lot of our basic structures in our lives. It's kind of like an earthquake in that the ground suddenly has moved beneath our feet. And also like an earthquake, the experience has been traumatic for many of us. And it's not been just one sudden shock, but we're still having a lot of aftershocks, and the impact is ongoing in our lives. And the impact just is not the same for everyone. As my wife tells me, we're all in the same storm, but we're in different boats. And by that, I think she means that people have different stressors from the same storm. Some people are extremely socially isolated without their usual supports. Some people have very good reasons to be worried about their own health, or they have loved ones who are at great risk. Some people have lost family members to COVID-19 already, and many have severe financial hardship. Almost everyone has great disruptions in their lives, and the future just is not clear. So COVID-19 is difficult for everyone, but it's particularly hard for people that live with a mental illness or have trouble with substances. And about half of Americans will have a psychiatric illness or a substance use disorder at some point in their lives. So these are extremely common difficulties. And the illnesses are confusing and painful, and no one wants to have one of these illnesses, and no one signs up to have one. The stress of COVID-19 can bring out psychiatric illness. So this is a hard time for many, many people. But there really is a lot of good news. For one thing, these illnesses are extremely treatable. People get better when they have access to good care. So it's very important to seek out support from others. Community is very important. And professional services are also available. Both mental health and substance use disorder outpatient care quickly shifted to telehealth services. And with telemedicine, fewer people actually miss their appointments because they're home or wherever they are. And people have expressed great satisfaction with the care that they get through teleservices. So if you're struggling, I urge you to seek out help from the doorways, from community mental health centers, and other mental health and substance use disorder service providers. We're all up and running and dedicated to meeting people's healthcare needs.
That's great, and I think so many important points that Will made, and particularly I love the quote from your wife that that we're all experiencing the same storm but in different boats, and I think that that's true for for people with mental illness as well as people with the general population. And there are some people that while there are certainly people that are struggling, there are some people that are thriving in this, certainly with the challenges that they face. But but for some people, it has brought a new focus and a different ability to cope, and maybe brought out coping mechanisms and resilience that they didn't think that they had. And that's an important piece to recognize as well. But I think that as Will mentioned, the change in the delivery of services, I think what's important for people to know is that there's such a broad range of services that weren't available prior to this that people can access online or via telehealth. And it's removed some important barriers that people experience to getting mental health treatment, like transportation or childcare, or caring for a loved one in their home. So so that's really an important piece to know, is that there are different online modalities, and we may talk about some of those. One of the pieces that you also talked about was substance misuse. And I just want to note that alcohol continues to be the biggest challenge that we face in New Hampshire relative to substance misuse. And it's very disconcerting to see that alcohol sales during March and April were up 43% in our state. And so people really need to be concerned about overuse of alcohol when they're stuck at home, or whatever, for themselves or loved ones. And there are some virtual supports available online, like AA meetings and whatnot for that.
Mm-hmm. Yeah, there are definitely a lot of resources available, and they never stopped. And like both of you said, if anything, there's even more resources that are available, and we will have those on our website too. So, Dr. Brady, how concerned should people be that they may develop a mental health problem as a result of this pandemic?
Thanks, Audra. I think that's a good question. I know it's one that's on a lot of folks' minds. I think it's important for the audience, for the viewers, to know that the anxiety response that they may be experiencing during this time, this is totally normal. It's adaptable. It's expectable. This is really, in some ways, anxiety's time to shine. It's an understandable response to a threat, or at least a perceived threat. So if you think of anxiety as serving the purpose of keeping us away from potential harms and potential threats, maybe acting more cautiously when we're out and about and doing things, then that's really anxiety doing as it's supposed to do. That said, when the threat is gone, or we have at least developed safer ways to manage it, then we can expect that our anxiety will decrease as well. So said another way, experiencing an increase in anxiety is not necessarily an indication of a mental health condition. The truth is that for most people who are experiencing an increase in anxiety, when the pandemic is resolved, and we know it will eventually resolve, we would expect that the anxiety also reduces, and that most folks don't go on to develop a mental health condition as a result of that. There may be some people who do experience persistent symptoms of anxiety. It's also likely that for some of those people, the continuation of that anxiety is really an instance where there was perhaps pre-existing symptoms that were more easily managed. The pandemic has kind of peeled away some of that ability to be resilient and keep those symptoms at bay. And so this means that there was kind of a pre-existing condition there. It's worth keeping in mind that anxiety disorders, as well as things like obsessive compulsive disorder, that these are not caused by singular events like the pandemic alone. So symptoms of these disorders are typically present to some degree prior to events like what we're all going through, but were more manageable. So this may also represent a general proneness to anxiety. All that said, the good news, and maybe the take home, is that there really are truly effective treatments, interventions for anxiety and related psychiatric disorders, including cognitive behavioral therapy and medications that even in the short term can be helpful to address these problems. So I want the people viewing to now to know that even if they do experience problems with anxiety after the pandemic resolves, that there are many caring clinicians here at Dartmouth-Hitchcock and elsewhere who are very well prepared to help with those problems using evidence-based interventions, things that really can be helpful for them in the long term.
And I think that's so important what you said about this is anxiety's time to shine, and recognizing and knowing when to get help. And I think a lot of us turn to our peers for help. So Ken, we know that peers, can be very helpful. So what types of peer support are most useful during this time of uncertainty?
Well, I think, Will mentioned that 1 in 5 people have a mental illness in their lifetime, and that's such an important statistic. And I think when we look at workforce, one of the things that is really come forward in the last couple of years is the presence of peer support in the mental health world. And I think that it's their time to shine as well, because who can teach us more about hope and resilience than somebody who has been there and somebody with lived experience? And for those folks to be able to help other people that are having mental health conditions and challenges right now is really key. So New Hampshire has 10 peer support agencies throughout the state. There are 2 clubhouses, one on the Seacoast and one in Manchester. And all of them are offering a variety of different peer support services that include educational programs, support groups, warm lines, and other types of supports. So those are all available to folks. I previously mentioned that a lot of AA groups and other substance use treatment is gone online and virtual. A lot of those resources are available on our NAMI New Hampshire website, www.naminh.org. And there's also, NAMI provides a lot of peer support for caretakers, people that have a loved one with mental illness, family members and others. And again, support groups, educational programs, making use of those things can be really helpful during this time.
NAMI is really an amazing organization. I know I've gained a lot of support from NAMI myself, as have family members now. But in my work, I've been struck over the years at how helpful it is to talk to other people that have been through similar confusing or painful situations. It's just a great relief and can lead to a sense of really being in the same boat and feeling that we can all get through it together.
So we have a viewer question here that came in. This is for Ken. How can loved ones of friends and family support people with pre-existing mental health conditions at this time?
That's a wonderful question, and the answer is in the question itself. And the answer is to ask that person, you know, what can I do to help you? What is it that you need right now? What is it that would be helpful for you during this time? And to understand that that answer may change, you know, during the, you know, during a day, during, you know, a week, during the course of this COVID situation. So checking in with people frequently to see what it is that they need and be very intentional about connecting with them. You know, think about somebody who, you know, maybe wasn't doing well before this started, or, you know, or who you know that that has been struggling. And it's important that we not let social distancing become social isolation. And then I think that the other part to this is to educate yourself as a caregiver, because there are materials online. And again, NAMI has a lot of materials for those people that are helping to care for somebody with a mental illness. And we know that some of the supports that have been available to them prior to this time maybe are more limited, in-home supports and those kinds of things. So, so I think educating yourself about what they need, asking them, and then the final piece is to really make sure you're taking care of yourself as a caregiver. That can be really emotionally draining, and it's important to get enough rest and practice good self-care skills.
I think that's a great point about we need to take care of ourselves so we can take care of others, and reaching out and making that connection for people, because that one phone call, that one text, that one email could really make a difference in someone's day. So thank you for reminding us of that. So as we wrap up today, I'd like to invite each of you to share a few points for viewers to remember as we navigate this time. Dr. Brady, let's start with you.
Sure. You know, as I was saying earlier, most folks will not go on to develop an anxiety disorder simply as a result of the pandemic. So I would encourage a lot of our listeners to accept the anxiety as that understandable and adaptive response. Additionally, rather than try to tease out, if, you know, is this anxiety due to the pandemic, or is this a pre-existing problem, I would really encourage all folks to work on reducing their overall stress level. If you think of stress kind of like the level of a bathtub, when the water level is low, you can get in, you can splash around, nothing happens. When that stress level rises, even putting a foot in can result in a mess. And instead, what we want to do is try to lower the level so that the existing symptoms or the existing anxiety doesn't overwhelm. It's something that we can manage and that we can continue with the important parts of our life.
So the points that I would want to make, worry, low feelings, and confusion are kind of a natural reaction, as Dr. Brady said, to this unwanted world event. But sometimes those feelings can get a life of their own and can become an illness. And if sadness, anxiety, or use of alcohol or marijuana kind of get a life of their own and cause distress or interfere with your relationships with people or with work, those are times where it would be really helpful to get a good evaluation and to get someone else's help in thinking through whether this has reached a point where treatment makes sense. So please do reach out for help. My comments, I'd like to conclude with just the hope that along with all this pain and confusion and disruption, that people can find some way to make new connections. It is an opportunity to reach out to old friends or to meet new people. I was out walking my dog this morning early on, and the sun was coming up, and the leaves are coming out, and the ferns are pushing up out of the ground, and it just made me think, well, maybe I really hope all of us have an opportunity with all this to learn something and to grow as well.
Yeah, those are such great points, Will. Thanks. And I think, a few takeaways that I have is that that the world has changed, and we need to acknowledge those losses and those changes that we've all experienced, whether it's economic or jobs or losing a loved one to COVID, the disruption to our daily routine, graduations, weddings, funerals. So many things that that we've always had that we don't have anymore, at least in this moment. So realize that and validate those feelings that you have, and then also think about mindfulness and reflecting on those things, those positive things that Will mentioned that we do have, and thinking about gratitude for those things. Staying in the moment is really important too, because it's the future that causes so much uncertainty, and that's what really creates anxiety. And developing a new routine for yourself. What can you do that's, because things are different, how can you have a new routine? Know that you're not alone, and that's the most important thing. And I think, again, just echoing what both folks have said here, just reaching out for help. And I think key takeaway is that all the mental health supports that were available before are still open. They're ready for business. They're available to help, and there's so many more now as well. And that's the full continuum from warm lines and peer support to crisis lines to telehealth to crisis care. So reach out. Don't wait if you're experiencing difficulties.
Certainly reach out, and the world has definitely changed, like you said, and you have all provided us with some great information and resources to tackle this new world. So thank you all for joining me today. I appreciate your time.
Thank you.
Thanks.
So next week, I will be joined by Dr. Ellen Flaherty, Director of Dartmouth Center for Health and Aging, and Geriatrics Director, Dr. Daniel Stadler, and we'll be discussing how seniors are navigating this difficult time. Thank you, everyone, for joining us. Stay healthy and safe. We'll see you next week.
Take care.
Bye.
Bye.